Welcome. In this lecture video, we are going to discuss about streptococcus pyogenes. General characters. Gram's classification. It is a gram-positive bacteria and it is spherical in shape. Arrangement chain form often having diplococcal arrangement. Motility is non-motile. Capsule is present. Endospore is absent. Respiration is aerobic and facultative anaerobic. Optimum temperature is 37 degrees Celsius. Optimum pH is 7.3 to 7.4. Streptococcus type is group A. Habitat is throat and skin. Pathogenicity. Disease transmission. Person to person spread by respiratory droplets. Direct contact with infected person. Incubation period is 1 to 3 days. Virulence factor. Antigenic structure, enzyme and toxin. In antigenic structure, M protein, T substance, nucleoprotein. In enzyme, streptokinase, deoxyribonuclease, hyaluronidase. In toxin, pyrogenic exotoxin and hemolysin, streptolysine O and streptolysine S. Pathogenesis. The hyaluronic acid capsule is a poor immunogen and interferes with phagocytosis. The M protein also interferes with phagocytosis by blocking the binding of complement compound C3b, an important mediator of phagocytosis. Finally, all strains of Streptococcus pyogenes have C5a peptidase and a mononuclear phagocytes and protect the bacteria from clearance from the infected tissue. Clinical disease, suppurative disease, pharyngitis, reddened pharynx means clinical disease, suppurative disease and non-suppurative disease. Suppurative disease, pharyngitis, reddened pharynx, it means mouth and nasal cavity becomes reddened with exuda. Cervical lymph adenopathy means enlargement of lymph nodes. Sclater fever, diffuse erythematous rash beginning on the chest and spreading to the extremities. Complication of streptococcal pharyngitis. Pyoderma, localized skin infection with vesicle progressing to pustules. No evidence of systemic disease. Erysipelas, localized skin infection with pain, inflammation, lymph node enlargement, and systemic symptoms. Seliculitis, infection of the skin that involves the subcutaneous tissue. Necrotizing facilities, deep infection of skin that involves destruction of muscle and flat layer. Staphylococcal toxic shock syndrome, multi-organal systemic infection resembling staphylococcal toxic shock syndrome. Non-suppurative disease, rheumatic fever characterized by the inflammatory changes of the heart, joints, blood vessels and subcutaneous tissues. Acute glomerulonephritis, acute inflammation of the renal glomeruli with edema, hypertension, hematuria and proteinuria. Lab diagnosis, gram staining, it is a gram positive cocci arranged in the form of chains. Motility test, it is a non-motile. Colony morphology and culture medium. In blood agar, grayish white, transparent to translucent, maty or glossy, smooth, flat, large zone of beta hemolysis. In mechanical agar, pink colored lactose fermenting colonies. Biochemical test, catalase, oxidase, urease and indole negative, methyl red positive. August Praskar, citrate utilization, starch hydrolysis negative, alkaline phosphatase activity, arginine dehydrolase, hyaluronidase, neuramidase are positive. Visitarsin test sensitive, PYR test positive, CAM test negative. Bactericin test. Streptococcus pyogenes can be differentiated from other non-group A beta hemolytic streptococci by their increased sensitivity to bactericin. PYR test. The PYR test is a rapid colorimetric method often used to distinguish Streptococcus pyogenes from other beta hemolysis streptococci with a similar morphology and the test for the presence of enzyme pyrrolinodyl aminopeptidase. This enzyme hydrolyzes L-pyrrolinodyl beta-naphthalamide PYR2 beta-naphthalamide, which produce a red color when a cinnamalide reagent is added. The test can be performed on the paper strip that contains tilled chromogenic substance pyrrolinodyl aminopeptidase within a few minutes. Serological test. Anti-streptolysin ASO test is positive. Antibiotic therapy and treatment. Streptococcus pyogenes are sustainable to penicillin. For penicillin allergic patients, erythromycin is a drug of choice. In some cases, chlamydomycin or vancomycin is recommended.